Welcome to the documentation for PCTs. We're going to get started by discussing the different requirements for PCT documentation throughout the care of your patient. The first thing you're going to do is get into Power Chart, Cerner Millennium Power Chart. You can select the Power Chart icon and you will log in using your Ellis login credentials, for which is typically your last name, first initial, and the password that you create during your onboarding. Once you've logged in, you'll see this blank screen essentially, and this is what we call Care Compass. The first thing that we'll need to do is build a patient list. You'll do this by selecting List Maintenance. You'll see it in the red box. This window will open and you will select New at the bottom of the box. From there, the first thing to do is select a patient list by location. So you'll select location. This is going to be the unit that you're on. If you flip between units, you can pull in multiple units in your patient list. So you'll select location, then you're going to open up locations, Ellis Hospital, then you have to open up Ellis Hospital again, and then you'll see the list of different units. You want to check the box next to the unit that you are wanting to select. The name will then enter at the bottom. You'll see the unit name, and then you're going to select Finish. The next type of list that you're going to want to create is called a custom patient list, and this is going to be a list where you can pull patients that you are assigned to for that shift into a separate list to work off of. So you'll again select New and open Custom. You'll then select the box next to Discharge Criteria and select Only Display Patients that have not been discharged. At the bottom, you will then type in whatever you want to name your patient list. You can say, give it your name, you can say PCT, whatever you want it to be. And then you're going to select Finish. From there, you will see all of the lists that you have pulled in or created under Available Lists. You will then select each one individually and use the arrow in the middle to pull it into the active list side. You can toggle your lists back and forth, so if you float to different units, you can pull in multiple units and just only keep the ones you want to see currently under active lists. So you'll pull them both over, or pull whichever one's over, and once you have the correct list under active lists, then you'll click OK. The next thing you're going to want to do is add your patients to your custom list. The easiest thing to do is you go up to that gray bar and select Patient List. From there, you'll see the two different tabs. You'll have the Unit tab and then the one that you labeled as your custom list. On the Unit tab, you're going to right click over the patient that you want to add to your custom list. You'll hover over Add to Patient List, and then your custom list will appear and you'll click on your custom list. Once you have done that, you can then at the top select that list, and that patient that you have added should show up under that list. If it has not shown up and you did click your custom list, there is a refresh button at the top right. You'll see so many minutes that have passed and circle arrows, and you can select that and it should then show up on your list. The next step that you're going to have to take is establishing relationships so you can start seeing information pop up on your Care Compass. So you'll go back to your Care Compass. So where you selected patient list by the number 1, you'll select Care Compass. By the number 2, you see the different patient lists, and you can toggle between your unit and your custom list. So you'll select your custom list. And then next to that, a couple clicks over, you'll see Establish Relationships. So you'll select that. It will open a new window. Then you'll see the red asterisk in relationship, and there's a drop down. You'll select your patient care technician or whatever your role title is. And then you're going to want to make sure that the patients are selected that you want to have a relationship established with. it automatically selects all of them. You can then, custom select which patients you want, but once you've determined which ones you want to establish that particular relationship with, you'll go to the bottom right of that window and click Establish. Then you should see the patient's name in blue, and you should be able to hover over different portions of the patient information and get some more information. When you hover over the patient box that contains their name, you'll see a vertical gray bar. If you select that bar, you will then see your Care Compass task list. You can work off of this task list. It's different things that you'll need to document or do throughout your shift. You can select in blue which one you want to document on, and then at the bottom right you'll click Document. It will take you into the patient's chart where it needs to be documented, or will open a new window to document that information. This particular task is called Basic Admission Information Adult. This is something that needs to be completed on a patient's admission to the unit by the PCT and or the RN. This particular task is shared between the nurse and the tech. Each role can edit that information, so if you start the document and save it with things not completed, the nurse can go in and then complete the task, and vice versa. The nurse can begin the information input and you can then complete the task. Once it has been fully completed, it will then drop off of both your task list as the tech as well as the nurse's task list. This is what the basic information looks like when you open it up. It contains your vital signs, your height and weight, safety measures, as well as reviewing the patient's valuables and belongings upon admission. Note that you'll see some on the left have red asterisks next to them. Those particular tabs have required information that must be completed in order to save that task as complete. When you open that particular tab, you will see the required information highlighted in yellow. So, for instance, the height and weight has a required element. This particular one is the patient's weight. We always need to have a good admission weight for each patient. A lot of our medications and things that we monitor for our patients are based on their weight. We measure in kilograms. At the bottom, there's conversion calculations, so if you know how much they weigh in pounds, it will convert if you put it in. Same with their height. For some reason, it defaults to 100 centimeters, at least in this environment that I'm showing you. So make sure that we do change that so things like BMI are accurate. Once you get into the patient's chart, you can do this by clicking on the patient's name from the Care Compass. It will open up to a screen similar to this. So in the green box, you'll see different, it's not going to be in a green box in the live environment, but I'm highlighting things for training purposes. But the green box will get you back to Care Compass for your patient list. There's a calculator in there that you can do different calculations. Ad hoc, I'll explain that in a little bit, as well as specimen collection if you're asked to collect certain specimens for the patient. And you also would exit out using the exit button on that bar. Just below that, highlighted in kind of a yellow color, is the patient's demographics, things like the date of birth, their medical record number, if they're a full code or do not resuscitate, their medical record number, different things like room number that you'll need to know. You can hover over and get some more information as well. On the left, highlighted in the orange box, are the different tabs that you'll use for documentation or to review different information on the patient. Things like interactive view and I&O you will use quite often for most of your documentation. Activities and interventions holds more tasks and another view for tasks. Orders, of course, is going to be the orders for your patient that you can review. Document viewing will have different documents that have been placed by other providers in the patient's chart. Results view holds a lot of the vital signs and labs and x-rays, radiology scans. Allergies. Form browser is where you can go in, and some that like that basic admission information for the adult. Once you save it, it'll be under Form Browser. You can go in and then right-click and edit if needed, or double-click to view it. And then patient information holds a lot of their demographics, like their address and insurance information. The MAR is the medication administration record, so you can see what medications they are on. And then the last thing that I have highlighted here is in that purple box on the right, again, is that refresh button. So if there's something that you feel like you need to be seeing but you are not seeing on the screen, sometimes it's just a matter of refreshing your screen and it will then show. As I mentioned before, activities and interventions is essentially the other task list, and it lists various tasks that need to be done. If you have a gray bar to the left where the arrow is pointing, that's something that you'll double click. It will then open up another window or take you into the chart where you need to document said information. Once you have documented and saved that information, that task will drop off of your list as well as anybody else's list that it is showing on. Ones that have yellow are things like blood sugar, blood glucose, and once you have performed that task, you will then just click the yellow box, refresh, and it will drop off of your task list showing complete. One thing that is important, as you can see on this screenshot, there's quite a few tasks left undone. Please, at the end of your shift, make sure that you clear your task list so it doesn't show as overdue or late on the next person's task list. When you open up Interactive View in I&O, this is again where you'll see the majority of your documentation. So we call this iView. You'll hear it referred to as iView quite often. This is where you'll document things like your purposeful hourly rounding, your vital signs. Measurement holds things like your height and weight. So if you do daily weights, you can put it in through measurements. Oxygenation, activities of daily living. We'll go through all of these as well, and what you would be expected to document in each one. So purposeful hourly rounding has changed a little bit since this, but this is where you'll document, whenever you are rounding on your patients. You can right-click over the date and time and click to insert date and time, and then that way you can document at the correct time. So you can edit that time to create a column for the exact time that it was actually performed. The other thing that is useful, that might be helpful, is if you want to document a little bit quicker, if you double click, you see this box by Vital Signs PCT. If you double click on that row on that column, you'll see the check mark come up, and you can document, and it'll advance you to the next cell to document the next portion of the information. So type in the temperature, press enter, and it'll automatically take you to the next box. Otherwise, you have to double click in each box to document. So you can play around with that when you get on the units, but it is quicker to just double click and then enter through each box. When you have documented information, you'll see that when it hasn't been signed, it'll be purple. So if you see this temperature temporal artery, it's documented in purple. So that means it hasn't been saved. It's not a final documentation. In order to sign off on the information, you'll come up to this green check mark. Once you hit that green check mark, it's been signed off. If you started inputting information and before you signed off on it, you decided, oh, this is the wrong patient, the wrong information, and you want to clear everything you have put in, right next to that green check is a green check with a circle crossed through, and that will clear all the information that you have put in. Once it has been signed off and saved, the wording or letters, numbers will change to black. From there, if you need to edit or delete any of that information, you can right-click over that information, modify, edit the information, and press save. You will then see this blue triangle in that box, and that just indicates that this information has been edited. You can right-click and delete or clear the information. You have to give a reason as to why you are deleting the information, and it will show in error in that box, showing that there was information there, but it has since been deleted. So, purposeful hourly rounding, you've seen the vital signs. Now, activities of daily living. This is where you're going to show your ADLs for the patient. How is the patient able to move? Things like, did we get them up to the toilet? Did we get them to dangle their feet on the side of the bed? Are they sleeping? Are they up to a chair? Patient positioning is going to be very, very important to document on our patients. We should be turning and repositioning patients that are not able to do so themselves every 1 to 2 hours. And in order to prove that we have done that, we have to document. So if it's not been documented, we can assume that it hasn't been done. So this is where, under activities of daily living, patient positioning, you can say they're on their left side, their right side, that we've repositioned them, or if they're sitting up in the chair, or refusing to turn, you can select other and document that the refusal of them allowing you to turn. Positioning, pressure reducing devices, things like we used a pillow or a foam wedge or a waffle cushion in their chair, whatever we have used to help reposition them to offload pressure. Different specialty beds and surfaces. You also can include the time that they spent up in the chair. How far did they walk? How long in time have they been walking around the unit? All of these things are important to show that we've been getting them up and moving them around, and how well they're doing, or how much we're helping them. Also under activities of daily living is nutrition. You can manually put in the diet type that they're on, as well as a description of the meal that they have eaten. But one of the most important things to do is document the percentage of the meal that they have eaten. This is going to be important in the patient's recovery, in the patient's treatment plan. So if they're eating 25%, we might need to do some supplementation of their intake. But if they're eating, 75 to 100%, then they are doing pretty well. Next, under activities of daily living includes things under hygiene, so the personal care that's provided. So did we provide peri-care or Foley care? Did we provide oral care? Have we changed their brief or their diaper? Did we give them a full bed bath, or did we set them up in the shower? Were they independent? There's also a place under other that you can document other things that you may have done. There's also, for patients that require the daily CHG bath, you can document under that it was completed for the day. Those are also, pre-procedures, patients may need a CHG bath, and you would document that they have received it there as well. Under that is the environmental safety management. So this is where you will document things that are in place to keep your patient safe, like non-slip footwear, those non-slip socks that we have on, that bed is in the low position, they can reach their call light, that we have the bed alarm on, anything that is pertinent to the patient. So if they are a patient that needs seizure precautions, you would indicate that those were in place if they were. Chest tube clamps, for instance, or if they're a one-to-one observation. You'll also talk about different precautions that you've observed, if they're a fall risk or if they're on isolation. General safety measures like the chair alarm or bed alarm. If you have those fall mattresses or mats on the floor, you would document that there as well. But just anything that you have in place to keep the patient safe from falls or from injury. This can be changing throughout the shift. So if something does change, you want to go back in and document it again, but it does need to be documented at least every shift. Next up is the gastrointestinal or GI, and this is where you're going to describe what their stool looks like or their emesis, describing if it's black, if it's brown, if we had a large bowel movement, if we had a black clay, what color does it look like, What is its consistency? Was it watery? Was it formed? Was it mucus-like? So we like to get descriptions of the stool or the emesis so that we can get a better idea of what's going on with the patient. If you look on number of bowel accidents, if you hover over anything that's in blue under the documentation, it will sometimes show a reference text. This can be clicked on. You can gain more information as to what they are looking for to be documented in that particular section. So anything that's blue, you can hover over, click on reference text, and it'll give you more information about that. Next up is genitourinary. So this is your GU or your urine. So this is going to be a description of the urine. What color was it? Did it have any kind of odor? Those are also going to be important in the patient's treatment plan. Nurse notification. So this is going to be important if you need to notify your nurse of anything abnormal going on. So if you walk into your patient's room to round on them and you notice that they're in pain, you want to make sure that you're documenting that you have notified that nurse and let them know that the patient's in pain. If there's an abnormal blood pressure or blood sugar, all those things are things that will need to be relayed to the nurse, so we want to make sure that we're documenting that we have notified them. You want to include documentation about the details of what you notified them about. Was it a high blood sugar? Was it a low blood sugar? Did you retake the blood pressure? Whatever it might be, as well as what nurse you did notify. You can put their name in as well. Next up is the individual observation record. So this are for patients that are on one-to-one. We do have this in paper form through FormFast, but if you have access to a computer, you can do your 15-minute documentation under individual observation record. And these are just some of the things that you have at your disposal to document as far as the behavior, affect quality, patient location. Mental health has different locations that they can be in, as well as what is their activity. Are they pacing? Are they walking around? Appears to be sleeping, that type of thing. So this is the individual observation record if needed for your patient that's on a one-to-one. Next up, under patient care tech, was all of that information before, but if you open up the bar that says intake and output, you'll see where you'll document the amount of oral fluids that they have taken in, as well as output that they have had. You can edit the different type of intake and output based on your patient. For instance, under urine output, if you click that box or that little icon that's in the red box, it'll open up this other window. So for urine output, if you have a patient that's getting up to the restroom independently, you may do a urine count. So they went to the restroom and had 1 urine output. If you have somebody you're measuring with like a device in the toilet or in a urinal or whatnot, you may do urine voided, and that would be in mLs that you would document the actual volume that they urinated. Same with diaper count. If you have an incontinent patient that's in a brief, you would do diaper count, and then you could put in that they had 1 wet brief or whatnot. Same goes for stool. You can have a number of stools. It's always important to make sure we know when their last bowel movement was. So if it's number of stools, you'll, if they had 1 stool, if they had 2 stools. If there's a liquid stool, you can edit and put in a volume for stool. Same with emesis. You can do a volume versus a number. Oral intake, you'll measure the fluids that they took in, whether it's their coffee, their water, their juice, ice, chips, or whatnot. All of that would be included under oral intake. You'll document this in the hour in which it was done. So it's hour increment. So in the 3 o'clock hour, you document however many they had during that hour. You might be asked to perform a specimen collection of urine or stool. So in order to collect that and get the right labels for the specimen, you'll go into specimen collection. You'll use a cart that you can go in and you'll scan the patient's armband. From there, you'll see the different things that need to be collected. You'll click the 3 lines to the right of that particular specimen, and you want to print the labels that are going to go on the collection device. So you'll select print, print label, select which samples you're collecting. So if you're only collecting stool, that's the only one you're going to check. If you're collecting both, you'd want to check off both of them. You'll then select your printer. It should default to the correct printer, and then you'll print your labels and collect your specimen. Then you need to mark that particular specimen as collected. So then you'll go, once you have printed the labels, it'll bring you back to this screen. You'll go back to the 3 bars on the right and select collected, and then sign off on it at the bottom. It will then indicate to the lab that it has been collected and ready to run the sample, as well as drop it off of the list of things that are needing to be collected. The last thing I'm going to show you is called ad hoc. So back on that gray bar at the top, if you select ad hoc, it will open up this other screen that has various things that you can document on. You can select under basic care, interventions and care, and all items. There's different things that you can search through based on what you're looking for, but your basic admission information, adult is there, valuables and belongings if things change, or a discharge if we need to look at that again. You can select that from ad hoc. If you need to document your orthostatic vital signs or a physician consult that you may have helped call in, all of that can be documented through ad hoc. So you would then click next to the item you want to document on, select chart, and it will open to where that needs to be documented. I believe that is the conclusion of the PCT documentation in Cerner. Once you are out on the units, the preceptor that you're assigned to can help you navigate a little bit more in detail as to what you will need in particular for your unit and your patient population that you're working with. Thank you so much, and I hope you have a wonderful day.